Cancer is a tough one. It's the big C, and it's very hard to talk about. It's terrifying when someone tells you you have cancer because there is so much unknown. The best thing you can do is to educate yourself on your type of cancer. Listen to your doctors. If you're not satisfied with the answers that you're receiving, find another doctor. Find someone who listens to you, someone who explains things so that you can understand it. Keep yourself in control. I think when you feel like you have no control, when you feel like things are out of your hands, that you can't make the decisions, that's when fear can really take over, and it can ruin your life. Make sure you have a good support system and control the things that you can control, and know that it's your body. You can make those decisions. Listen to your family, listen to your loved ones, listen to your doctors, but ultimately those choices are yours. And you do what's best, what you feel is best for you. When you do that, you are taking control, and you are fighting back the fear. You are, those are the things that give me hope when I feel like I'm losing hope. Having a wonderful support system is a number one priority. Seek out those people who love you the most, who can support you, who can be there for you every step of the way, whether you want to laugh or cry or scream or shout or hit something, hit a pillow. Don't hit somebody else, hit a pillow. Find ways to express your feelings to those around you. And sometimes it's okay to say, I don't want to talk about it, I just want to cry. You can't fix it. You can't do anything for me but hold me and let me cry. Sometimes you just need to cry. Females do. Not sure about males. Females need to cry. But I think if you do those things, the other thing that I think is most important is to rely on your faith. Rely on Heavenly Father and the blessings that He has given you. Knowing that I had the opportunity to raise my girls when I was 27 and they were so little, I cherished every moment of that. Having another baby after the melanoma, knowing that I could raise my children. It was hard on my youngest when she was 14 and I had the ovarian cancer. That was tough. I didn't want her to be my caregiver. She was just starting high school. I wanted her to be, a teenager. I wanted her to have fun, and I didn't want her to be my caregiver. I knew she would already have to do a lot of things that a lot of 14-year-olds don't have to do for their parents, but she was wonderful. Like I was saying, she was 14. She was just starting high school, and when I had the ovarian cancer, and I did not want her to be my caregiver. I wanted her to lead as normal a life as possible, be a regular teenager. She was on the high school dance team and things like that. I wanted her to have fun and things, and I was able to do that until the next year when I lost my legs, and then she had to drive me around. She got her driver's license, had to drive me around and take me to the grocery store and help me in and out of my wheelchair and load my wheelchair, and she had to do a lot of things around the house that I couldn't do. She was a typical teenager, but she was a big help, and she kept me active going to her dance competitions and performances and things like that. So that got me out of the house. It helped me not focus on myself. You can have a really hard time with depression after things like this that happen, and I was able to stave that off for a couple of years after I lost my legs and everything. And I kind of got into a cycle where the phantom pains, which are amazing. I have learned so much about my body and how my body works, how phantom pains work. There's a lot of therapies you can do. There's like, tapping your limb to help redirect the nerves and send those pain messages, or itchy foot, or sometimes it feels like someone's taking a ruler and popping it and slapping it against the bottom of your foot. Your toes feel like there's an itch, like you could wiggle your toes, like you could stretch your feet, things like that. There's a lot of techniques. There's mirroring techniques that they teach you to help with phantom pain. Things like that to help with that. But you can get in a cycle where you have a lot of phantom pain, which helps you not sleep. And because you sleep, you do not have pain resistance, which is in a vicious cycle. So pain, no sleep, pain, no sleep, caused me to have some just depression issues. They have found, though, that a lot of depression medications help with chronic pain. And so I was on Zoloft for about 6 months, taking sleeping, just over-the-counter sleep aids. 2 or 3 times a week helped me to get the rest that I needed, which helped, build up my pain tolerance. Vitamin B12 is a good one to help with pain tolerance as well. I was deficient in that, and so I take good vitamins and trying to take care of your body, eating right and trying to eat right and sleeping and those types of things help with the phantom pain and things like that. And lots of funny stories about limb loss and lots of kooky people out in the world. When you post things about your limbs or being an amputee, there's a lot of nutcases out there. Be careful of those. But for the most part, it's been a long road, but I have been able to accomplish a lot of the things that I've wanted to do, even though I am a bilateral amputee and cancer survivor. So